Welcome to Character Explorations, a podcast production of the Wentz Center for Character Education at the University of Dubuque. I'm Annalee Ward, the director of the Wentz Center. And our guest today is Dr. Ken Turner, Associate Professor of Science Education. He is the author of the article, Science and Integrity, A Pandemic Lens. This article is available online at dbq.edu/WENDT in the volume Character and Crisis, Volume 8. Welcome, Ken.
Well, thank you. Thanks for having me.
As we record this, the COVID-19 pandemic is not yet over. In our experience thus far, we've seen that numerous issues, often politicized, have arisen about how to best manage, treat, or even live with this. I can only assume that responses to your article will reflect those divides. Could you describe a couple of scenarios that illustrate some of the contentiousness?
These are pretty obvious with almost anyone who has interaction across many people. Some people are adamant that masks represent a violation of their civil rights. Others consider mask wearing to be a matter of community good. Vaccines have gotten headlines for the amazing efficacy and how quickly they were rolled out, how quickly they even came to the forefront. And at the same time, the fact that we did not achieve 70% vaccinated status by July 4th in 2021, as President Biden had hoped. So there's a lot of issues with COVID that tend to divide and not unite, and yet it is. It's not a political virus, and the virus doesn't care. The virus doesn't vote. It just is. And I guess it's up to us to figure out ways to understand the virus and to make life safe as we go through.
All right. Thank you. Before we go any further, I'm sure people are wondering why you're writing about science and integrity. What is your background, or what do you bring to this conversation?
I'm a science educator. I've been in science education for, I bet over 40 years now. I had a supervisory certificate that went down to the K level. I've taught from 6th grade up to 12th grade and now college. And I've been at University of Dubuque teaching mostly chemistry for the last 8 years.
Thank you. I think sometimes people want to understand what you bring, and just understanding that you've been living in this world of science for so long is important to our conversation. But because your work is part of an issue on crisis, could you say a bit more about what you mean by crisis?
Well, according to Beth McCaw, a colleague here, and I think I've got a couple of other citations as well. A crisis, one way of thinking about a crisis is when the stressors, the things that we have to do or think we have to meet, exceed our resources. And at a personal level, when people were, imagine any number of families. Imagine your own family. When you had to be separated maybe from some family, some friends, some loved ones. Your job, maybe it went online, or maybe there were added precautions, or maybe your job disappeared altogether. A lot of children switched to being educated at remote. So they were at home. All sorts of stress was added to the typical person, and very little additional resources were available to them. So when your stressors exceed your resources, that gap is where the crisis falls. So individually, we had crises. When you multiply that across the entire country and even across the world, and hospital beds were filling up, any elective surgery or elective procedures were being put off. Parking lots were being turned into triage units for people coming in with COVID symptoms. Certainly the hospitals were experiencing a gap between their resources and their stressors. And then you think about the responsibilities of the states and the country itself, the federal government and the state governments, as they tried to bring resources to families and companies and hospitals across their unit. They too were feeling an inability to meet these new stressors with the resources at hand. That's a crisis.
This excess stress that we've all experienced has also resulted for so many people in growing frustration and then anger and confusion in the responses to COVID. People were told, trust the science, but then seemingly the science changed. I think we all need a little help being reminded about how science works.
Thanks. So I've lived in the world of science education, as I mentioned before, for over 40 years. And science is never overnight. Science is never immediate. Science is not microwave. Science is a slower, methodical kind of piece by piece incremental look. I mean, not always. There's breakthroughs, but for the most part, science is sequential and time consuming, and it's a way of looking at the world. But then you look at the world, whether you're looking through the lens of a microscope or an electron microscope or a telescope or any number of really wonderful, amazing pieces of technology, you're still looking at the world, and you collect the data and you analyze the data and you try to interpret the data and evaluate the data, and then you would present it. But the presentation, that takes some time also, because if you try to publish, which is the way that scientists present their findings, that article that summarizes your results and all your data and all your thinking going into it, and on the basis of everything else you've done leading up to it, that is presented for peer review at that journal. And so 3 or more scientists who are working in a similar or related field will take a look at your findings and try to verify them, try to see if it meets the rigor of a good scientific study, and see if it's worth printing, or if it needs some minor changes, or if it should be discarded. And so that peer review process, the science that led to that article, and then the peer review process, that can take months and months and months. So if, as the pandemic seemingly raced from January 2020 to impacting so much of the U.S. by March 2020, let alone the entire world, science doesn't work on that scale of speed. And so the answers that we wanted, they were not going to happen overnight. We were not going to be able to tap a scientist on the shoulder and say, what's with the new virus? They just didn't have the studies. The studies either hadn't taken place or hadn't gone through peer review just yet.
One of the things that you do in this article is take up a few questions that people have that were contentious, where it seemed like science changed its mind all the time, if we could put it that way. So what I'd like to do is walk through some of those questions.
Sure.
The first one that emerged way back in January of 2020, we wondered, was it possible to have human-to-human transmission? And the science seemed to have one response, but then it changed. Talk about that.
So, yeah, and I think that's at the heart of a lot of people's mistrust is they misinterpreted what a scientist said, or the media reported it poorly. I think, for example, one of the first cases was, is person-to-person transmission possible? And very early in January 2020, I think one of the first WHO releases on it, WHO being the World Health Organization, said that it seemed possible, but that authorities in China had said they had not witnessed any of that so far. And that was very early in January 2020, and the China authorities were researching this pneumonia of unknown cause in Wuhan. And then not very much longer, like 2 weeks, 14 days, 15 days, another guideline came out, not a guideline, another statement from WHO said they had received 8 cases. They had proof of 8 cases in 4 different countries where person-to-person transmission had occurred. So it seems like, well, why is a scientist first saying that it seems possible but unlikely? But if you read their actual statement, they refer to exactly what had occurred and what they knew at the time. Very early in January 2020, we didn't know of any cases of person-to-person transmission. And the Chinese authorities had said they had observed none, and they were the boots on the ground, so to speak. But by the end of January 2020, we had 8 known cases, and those were, verified, scientifically proven cases. So we had, at that point, we had to change, as if I was one of those scientists, it was truth-telling as far as those scientists were concerned to state categorically that they knew of 8 cases and this was occurring.
Another question you take up was that in February of 2020, we wondered, could the disease be spread by asymptomatic people? And again, we thought the answer was no and then yes. So talk to us about that.
No and then yes. So I think if I go back to the WHO World Health Organization, some of their releases in February, early February, it said it is possible that there may be individuals who are asymptomatic that shed the virus, but we need more detailed studies around this. Okay, and so they actually seem to be asking for those studies. It came up again in early June. So there you're 4 or 5 months later, and she said, Dr. Maria Van Kerkhove, head of WHO's Emerging Disease and Zoonosis Unit, from the data we have, it still seems to be rare. And so I'm emphasizing the word seems, but that is what she actually said. But that just means that the fact that she even used the word seems means and didn't refer to a study means that the study hadn't been published yet. But finally, by January 2021, An article in Journal of American Medical Association Network Open found that the proportion of transmissions from individuals who did not have symptoms was estimated at greater than half of all transmission. So it does feel like there's this back and forth, but those scientists, those representatives from WHO, which I keep quoting, they were presenting information that was up to date, and those studies just hadn't been published yet. I find it really frightening that more than half of the transmission is occurring with people either before they show symptoms or even people who never showed symptoms. But that is the definitive answer to that question as far as we know now.
Right. That's that way that science
up to
unfolds.
January 2021.
Well, another question you take up is the mask wearing advice, which seems to change. What happened from January to December of 2020 to go from mask not required to mask should be worn?
Yeah. The same kind of thing. The same kind of thing happened. It's just a matter of which study, of even having studies. So in January 2020, again, a WHO statement said that an individual without respiratory symptoms, a medical mask is not required, as there was no evidence available on its usefulness to protect non-sick persons. Now, if you kind of team that with our understanding of asymptomatic transmission, they didn't think asymptomatic transmission was occurring at that time. And so what good would a mask do? And could it do could it have any effect? And there was no study released at that time. And then by December, their guidelines became masks should be used as part of a comprehensive strategy of measures to suppress transmission and save lives, make wearing a mask a normal part of being around other people. And that was at the end of 2020. So what happened in between? The first directive notes that there's no evidence available. No studies had been published. By April, a kind of culinary work that hadn't gone through the rigor of peer review said that public mask wearing is most effective at stopping the spread of the virus when compliance is high. The decreased transmissibility could substantially reduce the death toll and the economic impact, while the cost of the intervention is low. Well, that sums it up pretty nice. That's from Howard, but it wasn't a peer review study. However, I did include it in my paper just because when you look at the number of studies cited in that, it was just really impressive. So it's kind of like a hint of things to come. It is not verified through the peer review process, but the peer review studies were coming along. One was published in April 2020, found that cloth masks were especially effective for source control. And what that means is when you or I put on a mask, that's not to protect us. That's to protect everybody else around you from the droplets from the virus that might come from you. And so that's what they found. The cloth masks were especially good at that. You see, most masks that ordinary people wear, not the masks that hospital workers are wearing, healthcare providers are wearing. Most masks don't provide much protection for you against the virus. They protect for other people around you from you. They give a little bit, they slow the range, they diminish the range of the droplets that might carry the virus. By July 2020, a summary of publications concluded. So this is already by July 2020, there's a summary of all sorts of publications, peer-reviewed publications that was published. So in the summary, the findings of this systematic review and meta-analysis support the use of face masks in community settings. And then a later one published in August 2020 that even with a limited protective effect. So some masks are better than others. And this study concluded that even with a limited protective effect, face masks can reduce total infections and deaths. And that was by Warby and Chang. And then finally, again, another summary study published December 2020 said, therefore, wearing masks in public is essential as its effectiveness has already been established by the current studies. That was a summary study. Again, your mask protects me, my mask protects you. And especially as we understood more about asymptomatic transmission, the fact that you could be shedding the virus without even having a fever or loss of smell or whatever other symptom might go along. The masks became more important, became seen as more important. And that's why by the end of 2020, after all of those, we have that WHO guideline that says masks should be used as part of a comprehensive strategy of measures to suppress transmission and save lives. Make wearing a mask a normal part of being around other people.
Oh, all right. You've taken us through the seesaw that all of us have lived through, but maybe our listeners may not have. And I'm wondering if you could pull this all together for us. Can we trust science?
Oh, sure. Well, yeah, trust is a good use, a good term to use there. So I don't think you believe in science. I think so this might be just me. I use belief for things that I can't prove, whereas science is for things that can be proven. I believe in God. I believe that Jesus Christ came to earth and died on a cross. I believe that, and maybe you or somebody else believes in a different God or believes in several gods, and that's a belief in. But science, we can trust when it's practiced with integrity. And integrity means that it's going to be transparent about the data that is presented, about how the methodology that was used to collect the data, the peer review process. All of those can give a person trust in what is presented. And that can shed a light on this still unfolding pandemic. As you and I are chatting here, Omicron is on the horizon. And in many states, the same science that brought us very effective vaccines is going to illuminate a path forward through Omicron and whatever comes next. We can't see what's next. We don't know what's next. But I'm hoping that we can learn from what we've been through to illuminate the pathway forward.
Ken, thank you for the reminder and the challenge that science practiced with integrity is a process-based resource that moves us forward based on existing evidence. During a pandemic, that evidence may not be instantly available as it grows and changes. Our guest today has been Dr. Ken Turner, Associate Professor of Science Education, and I'm Annalee Ward for Character Explorations from the Wentz Center for Character Education at the University of Dubuque.